Good evening.
Hello.
We look like we've had a little bit of a ragged day because we did. It was a long day.
Yeah, it is 8:30 now.
We started over 12 hours ago. So I'll let you do most of the talking today, but it was Ed's post-op and treatment planning day, which was basically going to reveal everything about the surgery he had, everything about his cancer, and then what they do going forward.
Yeah.
So I'll help fill in the blanks for you because you got a lot of info today.
And I'll probably forget things, less for language and more for just, it was a long day.
It was a lot of it.
We've also been a lot more we've been doing a lot more napping because we couldn't really do anything. And
then today you didn't get a nap.
all day since early this morning. Mm-hmm. So it's, so we went to Moffitt, to the cancer center. We started with
your post-op appointment.
Post-op.
Staples, stitches.
Oh, that actually... By the way, I will not, I won't mince words. It hurt. It hurt to get the staples and the sutures out more than I guess I was prepared for.
I think there were even though we were looking at them for the whole 2 weeks, there were way more sutures. And at the point where the nurse was trying to be delicate, the doctor was like, let's just get him out. And basically I could watch Ed and see him pulling, but.
Yeah, there were a few times where honestly, I said, I can't talk for a second.
But he was going for 90 seconds of pain where the nurse got through 3 sutures in 3 minutes of pain. So he was just like, let's get him out of here.
Job.
Yeah, they did great.
They got him out. I think we got them all out.
I checked and everything looked good.
I triple checked and they said sometimes it still happens, but I think they were very thorough and got them all out.
She was checking you for those staples because even she jokes around the doctor is staple happy. So
hey, if you want to keep my skull together, please go for it.
Yep.
So the main thing was, first thing we had the sutures and the staples out and everything, and like I said, hurt. But now we're on the other side. It's like a lot of things, you're over it.
For me, the doctor was really good about hearing some of my complaints about being a caregiver again to him.
Yes, he really was.
He was really good at listening. I don't think he understood because he's not been in the position, but he definitely heard and, to the best of his ability, empathized with, we should have gotten more and we were asking for it. He was surprised you didn't have at-home health aid to come do it, even though he didn't think you needed it. If you requested it, he was surprised you didn't get it.
Yeah.
So we won't dwell on that, but there was clearly in our system a communication lapse, and he was also surprised.
But we'll move forward, move on.
Your pathology was also part of that appointment.
So we have, it really was sort of what we kind of knew. It is essentially the type of cancer we've been told, which is...
Do you want me to just give the official? So
yeah. I mean, it doesn't matter too much. If you don't need to know, you don't need to know.
No, because also Ed's is very unique, so I don't want anyone to try to go and Google this or think you might have...
Definitely don't Google and tell us.
No, it is super unique, but it's what we were expecting. We just got more details to it. So Ed had what was called a grade 3 astrocytoma. And what's super important to recognize is, I didn't know this till today, I don't know if you did, grade 3 is not stage 3. Because Ed's cancer is a primary brain tumor, which means it's mutated brain cells. They don't stage brain cancers because they don't metastasize the same way. They're not from somewhere else on the body. Right. So the way they talk about brain cancer is a whole different storyline than your other typical cancers.
Yes.
So grade 3 doesn't mean stage 3, but it is what's considered a high grade. It's the beginning of high grade. Yes. But as the surgeon mentioned to us before the surgery, it was behaving like a low grade. So it probably had just crossed that over, and it's been a slow grower. So what we found out was it was a grade 3 astrocytoma. It had a growth rate that was in single-digit percentiles. 4% growth rate. And it has a whole bunch of genetic markers that make treating it and the prognosis for management way more positive.
Yeah,
so
I mean, it is one of those things we've said a few times, but it was the
best of the worst.
It was the best of the worst. It is... again, it's brain cancer, but they're not, they were realistic and not...
So the way the last appointment of the day was the neuro-oncologist, basically the doctor that'll be treating Ed's cancer from here on out.
Yep.
And the way she said is it is a cancer. It is a quote-unquote bad cancer, because it's what it is. It's a brain cancer. It does not have a cure. Okay, we knew that already because it's a primary brain tumor. It's infiltrated. But when it comes to all the markers and dispositions of a brain tumor that are known today, Everything she was writing down on the sheet is a positive, positive, positive for making this a manageable brain cancer. So while some people were talking about, statistically, and they all say they hate statistics because they group too many things together, and these often aren't uncovered.
I'll very quickly touch on that. My main thing, and I think this is most people's probably, is, well, what's the prognosis? How long do I have? How long? And they said, the problem is you can't get that clear data because it includes people with the different range and it includes different age ranges. If somebody who's 75 years old versus somebody who's 38 years old has the same spectrum here, and we're all kind of dealing with the same diagnosis, so you can't get clear things. Because
brain cancers are a little bit more rare, and they're finding, and I want to touch on something about yours, they don't have enough data to really start to segment out, yours is this type, which means this. All of it goes into the same population. So that's everything from a low-grade primary brain tumor all the way up through glioblastomas. They all go together for the statistics. That's the kind that's basically more or less untreatable. Yeah. What's interesting about EDS, and even the doctor was excited to meet you, they don't see young grade 3 tumors because they're not symptomatic. Yeah. No, this goes to further do your preventative care. They're not symptomatic. Mm-hmm. If it was growing that slow, they would have seen it by accident at a grade 2, or they usually see it at a much further advanced grade 4 or glioblastoma. Because you happen to find it on a whoopsie, they get to see you with an early grade 3 with a relatively good prognosis, and you have the opportunity of potentially, because of some of those markers, if there's room in a clinical trial, being part of a clinical trial.
Yeah, and so I'm going to go right to, I want to quickly just touch on something I think a lot of people are going to wonder, and the answer is, I don't know. We don't know. Mm-hmm. We don't know what prognosis looks like. The people who are specialists, and this is all they do for their job every single day, they do not know. They're not looking at me like, oh, I have days or years, but they're also not looking at, I'm not, they don't know. Mm-hmm. You could say it could be a decade. It could be more. It could be less.
The way we phrased it to kind of cut the questions off at the beginning for the family and the friends that we were texting immediately following was basically, they did not tell you are terminal. You're not. You have a cancer that you will be managing and living with for the rest of your life.
Yes.
But as the neuro-oncologist said, she expects many years of close friendship with you. They're not concerned that this is something that's going to have an immediate demise, if you will. It's going to potentially have future treatment.
Yep.
It might be a future surgery. It might be a future localized radiation. But again, the biggest component of that also is, in the future, the technology is changing rapidly. They already have new things they didn't have 6 months ago. So you will be part of that.
It was a constant state of back and forth, even with the oncologists and the surgeons. It was sort of a back and forth all day of they can't give the info. They can tell you, it could be a few years, it could be less, it could be great, this could be something that lasts a long time.
Mm-hmm. And the other thing was all of your positive markers magnify and multiply that prognosis, but they don't know by how much or what it was to begin with. So it's fair to say Ed has a fight worth fighting, and it will be for the rest of his life, but there is no point in at all even considering laying down and giving up today.
That's our main thing. Was, I am upset and I am hurt that I have to do it. And I'm not going to pretend that that's not sad. Mm-hmm. But also at the same time, at this point, I don't have the right to not fight. No part of our team specialists are looking at this and saying, ugh. It's like, well, you just keep working on this and we do this thing and you do that thing. And, it's just every little thing we can do to keep fighting it. They were realistic. They were not panicked and they were not cheerful. It was sort of, it stinks that it happens, but you can do this and you can keep fighting and that's it. That's all you can do.
And again, they were making it very clear to you today that there's not even a little bit of inclination in them that you should at all give up. It's kind of interesting how they don't even consider this for you and your circumstances to be a fight. This is just what you're going to do. This is how your life goes forward now. So again, prognosis is good, but we don't have detail. Yeah. It's better than it could have been. The actual tumor is I would say slightly worse than I think what you were expecting because it did confirm it was a higher grade.
So really, it was more the type of
It's
cell.
the words. It's the words. The words don't matter, but they're scary.
Yeah, but I'd love to say, even until the minute they tell you, there's still this like part of your mind and your psyche that says, well, maybe it's not that bad.
Mm-hmm. Oh, last night we were sitting in the living room talking about, well, what might it be if they find out that they did the pathology and, oh, it wasn't cancer. What else could it be?
That's not true, but unfortunately today was one of those, the defining line where we had to say, no, this is real. This is, there is not anything other than this is a brain cancer of a higher grade. And that's just what it is. Yeah. It's not good news, but it's certainly and far, far, far off from what bad news could be.
I also want to put a little bit of a disclaimer in here because I know a bunch of people will want to ask questions. Depending on questions that do come up in the comments, and I want you to feel free to ask them, we'll try to answer them the best we can, but some of them we might politely refrain from answering because something that we learned in our confusing appointments today is typically the answer to a question would be this. But because you have the genetic markers of this, this, and this, we have to answer it this way.
Yeah.
So even the surgeon said, if you go and you find an exact case, or not the surgeon, the neuro-oncologist, if you find an exact case of a grade 3 astrocytoma, chances are it's an entirely different case because it didn't have those genetic markers. So she said there's still not enough of a population for you to go and Google. She knows what she's doing with this info. She can share it with you. So if we don't answer your questions, it's because it is such a wish-washy answer.
We're not doctors.
Correct. And we're not going to disclose your stuff either for that reason.
And also, please, we are not your first source. You probably should be talking to a doctor.
Yes.
But also, the specialists, and this is all they do, is they literally do this research and do these type of operations all day, every single day, and they are still figuring out the pieces in the puzzle. Your
surgeon was a brain cancer only surgeon.
Yes.
Your radiation oncologist today is only brain and spine, and your neuro-oncologist is only brain and spine cancers.
And they have done in other parts of the country, in other countries, and this is all they do.
Canada,
and they were saying that it is not what I think was good is that they didn't try to just make things up in any way, shape, or form. They didn't say, oh, maybe it was your diet, or maybe you ate something, or maybe you did this thing wrong. It was there is zero evidence anywhere in any shape or form that links this thing or that thing. There's nothing that links that says, if I had done this, I wouldn't have brain cancer. I think sometimes it's frustrating because I think we want to say, oh, if you had done better with your diet, or you had done better with, X, Y, Z. Maybe I use less on my phone, or I watch less TV, or it doesn't. There's no correlation. And she said that's very important to remember is that this is what the specialists are saying. There is no evidence to this, and that's important because you can very easily blame yourself and say, God, if I had just not done this, I wouldn't be in this position.
And that's the first thing all the surgeons, not all the surgeons, but all the cancer teams are big about. Even if you could have made better decisions, you didn't, and you're still fighting cancer, so what do we do today? So
we need to get you better today and focus about you and getting better.
Yeah, when she was talking to you about the clinical trials also, which we're still waiting to hear on, but you kept saying, well, I want to be able to, put information out there so someone never has to go through this. And she finally put her hand down on the desk as if to stop you and say, what about you? If I can get you in the clinical trial, aren't you interested in you having that medication? And she made it very clear.
I think actually had to say it twice to me because I am the personality of, oh, this would be great to help for other people. And so nobody else ever has to sell through. And she's like, what about you? You're in this moment. You need this strength. You need this treatment. I now need to be treated. And I need to worry about my health, and obviously the goal one day is that nobody has to deal with cancer. That's always
we were all in the room laughing that hopefully everyone's unemployed in our lifetimes in the cancer hospital,
but in the moment I need the treatment.
All right, so let's jump into right now from what we know, waiting on the clinical trial to see if there's a space or not. What is your treatment looking like?
So we are going through the same path that we talked about initially, which was we are still going to do chemo and radiation, an aggressive treatment of it.
So, do you want me to give the details of that, basically? Because brain cancers are, again, a little bit different.
Yes.
So, it's 6 weeks of radiation, like any other, or most other cancers in the radiation. So, you'll go every day for a 15-minute radiation treatment, which is about an hour from check-in to check-out.
Yep.
And it'll be every day for 5 days a week for 6 weeks, so 30 days of treatment. They also will be giving you an oral chemo medication that they have found that it is good for helping enhance the radiation with the targeted brain stuff. So it's not a systemic chemo that we all know from the movies and things like that. You're going to take a pill. It only affects the DNA of these types of brain cells. So it basically breaks down the resilience of the brain tumor. So that way the radiation is more effective. And then periodically after your radiation session is done of 6 weeks, you'll do periodic chemo to just continue to keep those cells knocked down. So hopefully they die.
It basically boils down to it's going to be a fight and then another fight and another fight. But in time, the fight spaces in between. So slowly you do get more life.
So after the first 6 weeks, you'll take, I think she said 2 months off or a month or two off because they need the swelling and the trauma of all that's going on in your brain to go down to get a baseline MRI again. And then every month for 6 months, you'll do 5 days of treatment.
Yeah.
And then it spaces out. And I think the best takeaway for us for all of this is your brain has been afflicted with this cancer. Because of the type of cells it was affecting, it's probably never going to completely go away. But as of right now, today with technology, where it is and treatments where it is, if you were to have a flare up in 3 years with today's technology, they can do targeted radiation and chemo again.
Yes.
Because the way the brain works, they can go in multiple times with radiation to treat already bad cells. So the risk of like the surrounding tissue is different. There's a whole bunch of stuff with brain cancer that when my mother had breast cancer, I learned about with her. It is entirely a different discussion for brain cancer.
It's a new thing.
You can have surgery again, and there'll probably be new technologies coming out. So they're not at all saying there won't be a recurrence of this down the road, but they are completely confident there's treatment options anytime they're like, oh, there's a spot. How are we going to treat that? Oh, there it is. So Ed's going to be under constant monitoring with this for the rest of his life.
Yes, I will. Yeah.
But there's treatment options for the rest of however long your life will be.
Yeah. I mean, it is, at the end of the day, this is the path in front of us. I still feel like you have a million little options, but there's really only two options. Either I could just say, nope, not doing it, not fighting, which makes no sense at this point. Even though sometimes it feels like it, that's not realistic because it's a real fight that we can still take on. So I think for me, I just need to know that it's gonna stink, and we're gonna hate it, and it's not gonna feel good, and it's not gonna be a short thing. But if we keep fighting, then eventually we get to go and live life, and none of
You'll
our
be traveling again. You'll be back to life again, and it might be disrupted here and there.
Yeah.
I think we summed it up really well. The four of us that were in the room at the end of the day. It was your neuro-oncologist and the fellow that was studying with her. The four of us really said it's just you still have an uphill battle, but the markers and the indications and the lifestyle changes that you can make will make that hill less steep. Yes,
each one of the checklists she kind of had that she wrote down for us was a pro right now. There was nothing in there that was against us, and while it's still a major thing, it
took the uphill battle and it kind of
the grade.
Yeah.
Well, maybe grades aren't the best term today, but there are a lot of
we'll go with slope instead of grade.
Okay. The slope is it's not. I'm not going to say it's not hard. It's not going to be difficult, and there's not a lot stacked against us work-wise. But we're going to keep going.
We are. And one of the most important things that I want to close out with is after discussing all of those treatment plans and medications and radiation and Ed asking questions about, alternative medicines and her just basically saying she can't say whether alternative medicine is good or bad, even bringing up medical marijuana, things like that. She can't say if it's good or bad only because there hasn't been trials to figure it out. But one thing that has been consistently studied and is consistently proven to have an impact on cancer treatment.
Really, it's basic health. So, this is not like something going to be doing a 1,000,000-mile running.
But keeping your physical activity
Basic
up.
physical energy. And that means getting up and moving instead of sitting.
Because that'll help your radiation fatigue and your chemo fatigue. So if you get that going already, you push through.
General diet, which again, she said, do not do some weird diet. Do not find something online. Just know what you should be eating and not eating. And
basically, she needs you to be eating a little bit of everything at any given point in time so she can work with you.
Yes, she was very adamant that there was zero evidence for any other kind of fad diet.
Keep your sugars in your diet, obviously to a minimal, but she said if you're the type of person that has a cup of coffee with some sugar in the morning, she doesn't want you taking that out.
No, just live.
Yep.
And
then the third part, I think, was one of the most important ones.
This is probably the most important thing that almost everyone watching probably should be taking as one of the takeaways for the day.
This goes for your whole life, too, because we've been talking about it outside before today.
You need to be focusing on your mental health.
Mindfulness is what she said.
Yes, at all times. And that's everything. That is meditation, that is...
she said yoga, Pilates, whatever you can get into.
Therapist, whatever you should be doing, you need to be doing. You need to be keeping your mind healthy, because that is the one thing that the data is showing, is researched, is keeping it active and stimulated and healthy.
And I actually think she said that was more important than the physical activity or the diet in continuously beating cancer, because the physical activity will help with the side effects of your treatment, but mindfulness will help you stay on the path to do those other two things. And the minute you said, was there a psychologist you can talk to at Moffitt the days you go for treatment? Everything is there and available. You have to utilize it because they took the cancer out of your brain for now. You need to get the cancer out of your lifestyle for now too. But when you're not fighting cancer, you need to not be plagued by cancer either in between.
And so that's the main thing, is just fight for yourself so you can get what you need.
No, you. Remember, you got yelled at today.
I'll do for me. I need to do for me what I need right now. And hopefully other people do the same thing for themselves.
And I think this video, oddly enough, had more smiles from you than what any of us have seen in the past 2 weeks. So a high five to you on this mentality. High five. So, Ed's got a battle ahead of him, but you're going to do it because you have no reason not to.
Yep.
So with that, we've had a very long day.
Yes.
I think I'm supposed to go try and edit this and get it all out to you tonight. So have a great night. Thanks for letting us update you.
Seriously, we're doing it together, all of us, really.
Yep, and hopefully now that you have a little bit more clearance, our next update might be from somewhere other than our house.
That'd be so nice.
You're cleared for it.
We did technically go to the cancer hospital. Was that the fun day today?
Please leave a comment down below where you'd like to see Ed's next health update from and where you'd like to see this smile happening.
All right.
But from our home to yours, have a good night.
Yeah, thank you guys.
Good night.
Good night.